A lot of women do ask about chemotherapy, and most of the time we can't tell up front. There are a couple of times that we know ahead of time if somebody's going to need chemotherapy. There's a type of cancer called inflammatory carcinoma of the breast, which is fortunately very unusual, but can be very aggressive, and that's almost always treated with chemotherapy up front. It's treated with chemotherapy before surgery. Also, if it looks like it may have spread somewhere, chemotherapy, I probably oversimplify it, but I liken it to an antibiotic. If we treat somebody with a sore throat with an antibiotic, that antibiotic will go through other areas of the body. If the patient has a sinus infection or a lung infection or a urinary tract infection, that antibiotic will treat the whole body. That's what chemotherapy does. So if we're concerned that this cancer may be aggressive enough to have gone somewhere else, they're going to need chemotherapy. It can treat places where we don't even know there's cancer. And our goal is for it to treat the cancer and kill the cancer before we even find out that it's there. The other people who need chemotherapy are women who have cancer in their lymph nodes. If it's in their lymph nodes, we know it's left the breast, and we know that once it's in the lymph nodes, it's more likely to have spread somewhere else besides the lymph nodes. My wife's stepmom was in that category, and that's why she had chemotherapy, and it tended to be pretty aggressive. 4 of her lymph nodes had tumor in them, and she was treated with chemotherapy, and she's fine. But again, if she did not have the chemotherapy, she might not be here with us. So it was an educated decision by her to make that treatment so that she'd be here now. And the other thing is there's some certain types of cancers that tend to be very aggressive, and they skip the lymph nodes. It's an unusual type of cancer. It may even on the surface appear to be a pretty benign cancer, but there's a genetic study we can do on cancers. And they tend to be cancers that are estrogen and progesterone receptor positive. Those are receptors on the outside of the cancer that usually portend a very good result. But some of these cancers, it's almost like they're masquerading. They look like they're going to be easy to treat, but then they raise their head and tend to have an ugly outcome. And there's a genetic study that we can do on cancers to check and see if they're likely to have spread even though they look like they didn't. So those women who are treated, and the study is called an Oncotype DX study. There's another study called a MammaPrint, and we actually do genetic studies on those cancers to see if it's likely to have spread. There are, sometimes we don't know if a cancer is spread, and that's the scary part. There are blood tests. A lot of times the medical oncologist will draw blood to see if there's some tumor markers that are in the woman's blood that can signify breast cancer. There are other areas that we can find them out. They can go to the cancer can go to the lung, it can go to the bones, it can go to the liver, it can go to the brain. And if there are symptoms of any of those areas that aren't doing what they're supposed to, we can find that out. Sometimes it's as simple as a chest x-ray or drawing some blood and checking liver functions. There are, sometimes again, it spreads and we don't know about it, and that's where we hope chemotherapy will be able to affect it. Even if it has spread though, a lot of times it is treatable. We can treat it with chemotherapy, and we can also treat it with radiation when it's spread to different areas.